Hi, this is Dr. Gullberg. Thank you for joining us on our Mnemonics for Medicine series. Today we're talking about cardiogenic issues, and specifically we're talking about shock. But I want you to think about the bigger picture of shock, the differential diagnosis of hypotension when you're in the clinic or the ER or the hospital and somebody suddenly has a low blood pressure. What are the causes? Well, the word we're using is ASHCAN, ASHCAN. Good mnemonic for the causes of shock. Our patient comes into the ER, his blood pressure is 70, systolic, heart rate's 130 and irregular, and he's got a temperature. You're thinking of the causes right away. Well, A stands for anaphylactic shock. First thing you want to think about, is there anaphylaxis going on? Has he had a bee sting, a wasp sting, some kind of a food allergy, and of course there's others. S is for septic shock. Look for SIRS, systemic inflammatory response syndrome. Look for leukopenia or leukocytosis, temperature, or even hypothermia. H stands for hypovolemia. Could be from a GI hemorrhage, could be related to significant dehydration. C stands for cardiogenic, often in the setting of heart failure, serious arrhythmia, an acute MI. C is for cardiogenic. A is for Addisonian crisis. Low cortisol levels can present with fever, look like septic shock, and just be an Addisonian crisis. Check those cortisol levels and give them some IV steroids. Finally, N is for neurogenic shock, often by a large stroke or a hemorrhage in the central nervous system. Remember that. So the big picture for shock is sometimes it's multifactorial. There's a couple of things going on at the same time. Remember ASHCAN as you look at the differential diagnosis of shock. Hey, thanks for joining me today. I want to remind you that we've got a series going on, so give us a thumbs up if you appreciate this mnemonic.